Good day. This is Dr. John Bennett, televising from sunny Miami. Here it's the morning time. Today we have another conference in the Congress of the ACNS and Neurosurgical TV for skull-based surgery cases and other topics. Today we have the pleasure of having a very well-known anatomist, Victor Hugo Perez from Mexico City, Mexico. And he'll be speaking about skull-based surgery anatomy and hopefully showing some of his excellent videos. Today we also have a few members of the panel. I'll introduce them before turning it over to Victor. Hello, Rakesh.
Hello, Dr. John. Hi, everyone. I'm Dr. Rakesh AV from India, a neurosurgical resident, and I'm very glad to be a part of this neurosurgical TV. And I'm looking forward for the presentation by Victor. Thank you.
Welcome, Rakesh. And Ipe, could you introduce yourself, please?
Yeah, thank you. Thank you, guys. It's been a great pleasure. Being here in this conference. I look forward to Victor's talk.
Very good. Thank you. Welcome, Ipe. And Simon?
Thank you very much. Simon here in Tokyo, neurosurgery enthusiast, medical student. Looking forward to this presentation. Thank you.
Thank you very much. And Victor, thank you for taking the time and welcome. It's all yours.
Yeah. Hi, how are you? First of all, I want to present. I am Dr. Victor Hugo Perez from Mexico City. I have been doing some research about the surgical anatomy of the brain, the skull base, and also the spine. I want to show you some two videos about the surgical anatomy of the arteries of the brain, and also a presentation about the surgical anatomy of the craniovertebral junction. Okay, let me show you the. This is what we are seeing now is the posterior communicating artery, but in this brain, the posterior cerebral artery of the right was not connected with the posterior communicating artery. The posterior communicating artery was arising from this communicating. Can you see the cursor of that I'm moving?
Yes.
Okay. 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 So this is the superior cerebral artery, the basilar artery. I am going to move the cerebellum in order to see the trajectory of these arteries. Can you see the cursor that I am moving?
Yes.
Okay. This is the posterior cerebral artery coming from the supraclinode carotid artery. This is the superior cerebral artery and small branches that are coming from the bifurcation of the basilar. This is the third cranial nerve of the right side. As you can see, there is no connection between the posterior communicating artery that is giving rise to the posterior cerebral artery with this P1 and P2. Okay, now we are going to see the arteries that are coming from the vertebral and also the basilar. This is the ICA, or antero-inferior cerebellar artery, the pica, posterior inferior cerebellar artery, the lower cranial nerves, some arachnoid attachment. In this side, we are seeing the choroid plexus. Here we have the ICA. The lower cranial nerves. In that, we are seeing the 7 and the 8 cranial nerve, choroid plexus.
You okay, Victor?
Yeah,
Okay.
I'm fine.
Okay.
In this case, you can see the antero-inferior cerebellar artery that is giving rise also the pica. The pica is not arising from this vertebral artery. It's arising from the antero-inferior cerebellar artery. So this artery is giving rise to both arteries, the ICA and also the pica. Some arachnoid attachment. I'm going to move the brain stem in order to see to the segments of the pica. This is the first cranial nerve, the first spinal nerve, excuse me. Okay, I'm going to change to the other video. In this video, I am removing the arachnoid attachments to the cranial nerves and also to the arteries. It's very important to work with anatomical models because the lower cranial nerves and also the small branches of the vertebral arteries and also the basilar are very important in this region. This is the arachnoid attachment to these lower cranial nerves.
Yeah, it's not. It's not. Can you play the video? Oh, there, it's moving. Okay, it's fine.
It's okay?
Yes, it's fine.
Okay. The anterior spinal arteries coming from the vertebral arteries. I have almost 100 brains injected, and we can do a very good job taking videos of these elements to show to the students, residents. Here are the lower cranial nerves, the 10th, 11th, and 12th nerves, the hypoglossal, the pica, posterior inferior cerebellar artery, the other side, the hypoglossal nerve, the posterior inferior cerebellar artery, hypoglossal nerve, lower cranial nerves, the 9th, 10th, and 11th nerves. Here in the cursor, you can see how is the vertebral artery passing between this hypoglossal nerve. The 6th cranial nerve, 7 and 8, okay. This is the end of this video.
Go ahead, Slaven. You go first.
Yes. Well, I would like to thank you for showing these beautiful videos, because you can really tell that those dissections are on the highest level. And I was wondering, how long does it take to make such preparation specimen of the brain that is injected with these materials, and that gives this great anatomical view of all the structures? And also, can you please tell me, have you done any videos in English, or are they only in Spanish? Or so? Thank you very much, and it was amazing to see this.
Well, thank you for your comments. I have too many brains injected, some of them with veins and also arteries injected, but I have not worked with videos. I am beginning to work with the videos, but I have been work in this kind of anatomic investigations since 23, 24 years ago. So right now I have all the material and I am beginning to work with the videos. I wanted to have the brains, and now I am going to work with the videos.
Victor, you can come off the screen share, Victor. Just click on the green arrow to get off it, so we can see you. Just click on the green arrow to get off the screen share. On the left side of your screen, just click on the green arrow to get off the screen share.
Oh, I'm not seeing the screen share.
Yeah, there we go. There we go. Okay, we can see it now.
Okay.
Okay. Any comments, Simon or Ipe or Rakesh?
Hello.
Go ahead, Rakesh.
Yeah, hello, Dr. Victor. It was a very nice presentation and an excellent video. As you said, it's a very good tool for the budding neurosurgeons and neurosurgery residents. I was amazed to see that you have anomalies coming, that ICA arising from the pica. Such anomalies, such brains you have, and you're been dissecting. I just wonder how did you get these 100 brains? So how do you collect?
Okay, I have been working in a forensic center. In this forensic center, I have that brains. So these brains were from unknown people, unknown people that are in this forensic center. The particular thing in this kind of research is that the corpse have almost 10 to 12 hours after they have died. You know, they are fresh brains.
Okay, that's excellent.
That's the reason you can inject and show the brain in a particular way.
Okay, that's great. Thank you.
Victor, what kind of substance do you inject the arteries? What kind of substance is that?
Excuse me?
What kind of substance do you inject to show the arteries so well?
Silicone.
Okay.
Latex.
Okay.
Latex colored with red for arteries and colored with blue to veins.
Okay. Any comments, Ipe or Caesar?
Hello?
Any comments, Ipe?
Hear me?
Yes, we can hear you.
Yeah.
Any comments, Ipe?
Excellent dissection, Victor. I'm looking forward to seeing you at the National Skull Base Conference in Jaipur, in India. I'll be leading the cadaver lab there, so we'd be very glad to have you teach residents with dissection.
Okay, I just have a question for Dr. Ipe and also Dr. Victor. Like, I just wanted to know if what are the cadaver dissection courses for the neurosurgery residents? So around the world, which is better? You people suggest to attend to have a better neuroanatomy.
Come to the National Skull Base meeting in Jaipur in September.
Okay, thank you.
That'll be a good course. We are covering from anterior to posterior skull base, and we'll also be showing vascular and all the other vascular exposure.
Okay, thank you, thanks a lot.
This is a question actually for Ipe. What makes those videos so good? Is it the resolution of the arteries that they're so clear? Is that what makes Victor's videos so good?
Yeah. For cadaveric injection, you have first generation, second generation, and third generation vessels. So, for example, the carotid is the first generation vessel, and then you have MC and AC, which are second generation vessels, which are branches of the carotid, and then you have branches of those, so they are third generation vessels. So if you have the third generation vessels seen, that's an excellent dissection. If they are seen to be injected, they are pretty good dissections. In Victor's, I was seeing that sometimes even the fourth generation vessels like lenticulostriates was so well seen. So that makes them excellent dissections.
Thank you so much.
Okay.
May I show you some video?
Sure. Sure.
Sure.
Ya está abierto. Ahora le doy acá. Aquí la flecha te aparece y ahí ya le doy a compartir. Okay.
Can you see this?
Yes, we can.
El sonido para
Okay. I am injecting in this video the Lave vein, the vein of Lave.
Okay.
Okay. Oh wow! Injecting it. That was a video of injection, right?
Yeah. Let me show you other one. Do I have a time?
Yes.
Yes, yes.
Screen. For example, this is a dissection of the spinal cord. This is the arachnoid, and this is the posterior aspect of the lumbosacral spinal segment. In this dissection, I am looking for the posterior spinal arteries. I am displacing these spinal nerves to see the lateral aspect of this spinal cord. So, as you can see, once we have injected these spinal cords, human spinal cords, we can see very well the microvasculature of the spinal cord. So, for example, in the spinal cords, I have almost 150 models injected, all of them injected with color blue for veins and color red for arteries.
Looks wonderful.
Yeah.
Can I ask you a question? Just a brief one. Is there any possibility that you will transmit your dissections on neurosurgical TV or in some other way? Because it would be really a great experience to see this, how you are doing this.
I agree. I hope that we can do many in English. A wonderful training.
We'll definitely want to get Victor on the internet with his dissections, both English and Spanish, if he's agreeable.
Yes, please.
Just
To the
because
world, to the world.
it's amazing to see such an experienced master neuroanatomist doing his dissections, and I think we can really. I've never had the honor to see something like this. Really, I mean, with someone explaining such in so many details those preparations which are of this quality. I feel like I'm attending Dr. Rotten's lecture right now.
Well,
let me show you this last video, please.
okay.
Yes.
Yes, please, please.
Is this is the basilar, the top of the basilar artery. Aquí estamos con la arteria. This is the basilar artery and the bifurcation. This is the superior cerebellar artery, the right and the left. And this is P1, but this is hypoplastic, and the origin of this posterior cerebral artery is coming directly from the posterior communicating. This is P1 in the left side, P2 left side, and the perforating branches to the mesencephalic area. Here, this is a beautiful beautiful view of the branches of these segments of the P1 and also the bifurcation of the basilar artery. We need to know this particular anatomical variants of this region, specifically for the vascular surgeons, in order to avoid lesioning these parts of the brain stem. I don't have these videos in the internet, but I am becoming to do these videos in order to show these beautiful dissections, beautiful arteries. Here are the third cranial nerve, the left, the right cranial nerves. This is the posterior thalamic artery and the mesencephalic arteries. And of course, I want to share. I want to share these videos with the residents, with the students, and also with my colleagues. I have the honor to be invited to Jaipur, La India, to show this work. I am very excited. I am very happy for this invitation.
Well, Victor, we hope to be able to help you communicate with the world from Mexico, so that people can enjoy these excellent dissections all over, not just in the Latin world, but in the whole world. We have to build channels and get groups, but I'm certain they'll be like Slaven and Simon and Rakesh and Ipe, that they will truly enjoy and be able to share, your excellent dissections. So,
Thank you very much.
so we appreciate you coming out today, and we hope to see many of your shows in the future, and we'll become more organized, and we'll get better with the tech, and we'll talk about that soon. So, okay, we're going to end this broadcast, but stick around. We'll talk. Thank you.
Thank you.